I think this is a little backlit, but overall okay, and then we might switch in a few minutes. Yeah, so maybe we could start by you giving kind of an overview of your assessment of the current usage of AI in healthcare, and like what are those usages?
Okay.
Take us away, we're rolling.
Oh, okay. So let's see. Where do I think AI is in healthcare? So I think there's a couple different ways to think about that. So there's where is AI in healthcare for the average person? And I think for the average person, it seems like there's an app for every condition you could possibly think of. There's a lot going on in the media now around people using AI for mental health, to address their mental health issues, let alone diagnosis issues, those kinds of things. And then where AI is for healthcare providers is it is very much being used for imaging, right? So people getting mammograms and things like that are CT scans, echocardiograms. They're seeing AI assisted interpretations of those images. There are absolutely places where AI is being used for care planning, and especially in the intensive care unit or when people are really sick. But the difference is, for the most part in healthcare, the AI is being used alongside a human that knows what the intended purpose, plan, context is. In the regular layperson side, for us, lots of times you're being presented with information from AI that you may not know any different, any better, because it's not your area of expertise. So it's harder to come alongside that AI output and be like, yeah, that seems right, or no, that doesn't seem right.
Because, you don't have a context for what's right or not right.
One of the things that AI is good at is giving an individual information in a way that is affirmative. Like, it wants a yes, it wants to be liked, it wants to answer your question, even if it shouldn't have answered your question, right? Yeah. So that part's very tricky for us mere humans.
In the imaging, so one of the things you mentioned is the use of AI as a tool for providers in interpreting or going through imaging. Is that the same? I'm just not educated on that topic, but I've heard a lot about this. Is that the same type of large language models that are being used for ChatGPT that's being used for provider assisted looking at different imaging or the like?
So it's not.
Or are we just broadly calling it LAI?
So we're calling all of it AI, and then for the sake of and in that sense, we're incorrect, right? Yeah. Because large language models and so much of the things that we call AI are really not AI, right? They just seem sophisticated to us because, ooh, you took something complicated and made it simple. So, ooh, it must be AI or it must be happening in the black box. So there is a lot of nuance to what is truly machine learning and all of those kinds of things. So what I will say is, conceptually, at its core, what they have in common is things like odds are this dot right here more than likely represents something benign, right? Is what, if it's looking, let's say, at a CAT scan, right? To say this dot is something that we need to look for, where sometimes that dot in the midst of other grayness is so small that even the radiologist might not have tuned into that particular thing, just because it might be so small, or the difference between normal and abnormal is really, really subtle. Those are the ways where it's kind of augmented, right? So in the healthcare space, I would say there's a lot more augmentation, right?
Yeah. What I was seeing, like, it towards the end of my undergraduate degree at a lot of these conferences and the like, when they were talking about AI in the health space, it seemed like what they were really excited about was less large language models and more machine learning capabilities. So the example we saw was the ability to take footage from what I believe was a colonoscopy,
Mm-hmm.
and then review, which would otherwise be like your intestines are, and your whole, you know,
Mm-hmm.
system is, it's quite a lot of footage to look through and have people sit there, and mistakes could be made. But because you could train on a single set of, you know, a set of data where somebody has gone in and identified, okay, here's what the polyps are and here's what
Right.
they look like, you could then train and do machine learning for what we'll broadly call AI,
Yeah.
to go through new video footage and be like, okay, here's where we're identifying issues and targeting those. So
while that is true, there is absolutely a lot of excitement in the large language space, because we're talking about documentation, right? So being able to have providers, you know, document their notes, because the AI is listening and it can make, you know, very detailed notes. It is also being used in some of the spaces for prior authorizations to read through the language and determine if the criteria is being met or not being met. Are certain keywords there as it relates to things like value-based care or risk adjustment? So there are a lot of spaces where the large language model in particular is really exciting. As fundamentally a primary care provider, as a family medicine doc, the documentation stuff is tremendous to outpatient and primary care providers, because, you know, so much of your time, unfortunately, is spent documenting instead of on care. So the big win potentially in that space is we can stop typing on our computers, right, and start looking back at you, so that then you can have our eyes and our ears instead of just our ears, which does so much more for the, you know, patient provider engagement, interaction. You can pick up on some of those subtle body language cues that you won't be able to see if I'm looking at the keyboard. So there's a lot in both spaces. In the large language space, one of the things I find could be a potential concern or kind of piques my interest is this idea that you brought up of keywords. Mm-hmm. And in a lot of other areas where we've seen algorithms, machine learning, AI, large language models come into play, what you tend to notice is that the trends that already exist or have existed in the past, keywords, styles of writing or speech, etc., are then utilized. And so the forthcoming users of whatever system that's been created and that is now being kind of run, so to speak, by an algorithm, by AI, by machine learning, then train people. Mm-hmm. So like if you are doing social media, for example, if you are trying to apply to any job right now, where your application is being reviewed by AI first, you are thinking heavily about keywords. So as opposed to being your kind of most authentic self in a presentation perspective, you are being whatever you think will be successful from a keyword perspective. So we are 100% right. So AI says keywords, and then here's output, right? Mm-hmm. But what clinicians and humans can do is say context, history, and then add those together to come up with a plan, right? Mm-hmm. I think that's the fundamental difference, why for the most part, I am certainly not aware of any systematic use of AI without human oversight, even in the documentation space. It will give you a note, but it is still the expectation that clinician, you are reading this note before you go ahead and sign it, which is why there will usually be disclaimers like this note was written by AI. That's not meant for you to not read it, but it is meant to just say, you know, this was not a person, which I also think is a really important thing that, again, lay people aren't getting. You're asking for, oftentimes when you're chatting with apps, entities, whomever, you don't always know who you're talking to. Am I actually talking to a person? Am I actually talking to a medically trained person? Because some of these things will kind of masquerade like you're engaging with a clinician when the reality is you're not. I think that is completely unfair and completely disingenuous, right? Yeah. And that is another place where, again, regular people are kind of put at a disadvantage because you're taking this input and may not even know this is a chatbot. Yes. One more question on the kind of large language models as a tool for providers.
in terms of the documentation space specifically and the note-taking space, one of the challenges that I think exists in today's healthcare system is the standardization of data across the board. Do you feel like large language models could be a tool for standardizing data so that when different systems, whether they be healthcare providers or payers or just individual doctors' offices, are taking notes, the ability to utilize that elsewhere, whether it's just to send from your primary care provider to the specialist that you have to see at the hospital, the heart doctor or whatever, or if it's in a larger way like de-identified data and research, those sort of things. Do you feel like large language models have the potential to solve a lot of the problems that professionals in the space are seeing?
So that I absolutely think is one of the strengths of where the large language models and machine learning, the combination of those things together really do have a potential to overcome that barrier that we thought was going to be solved with electronic health records, right? We thought when we get electronic health records, all of a sudden, oh, you should be able to see that, right? But that's not really how it worked. And the other thing that it is able to do is it is able to take unstructured data, right? So for example, images. So my live pictures of my echo in real life or that colonoscopy footage, right? That's not going to fit in an Excel sheet or those kinds of things, but it can also ingest that information and then be able to transfer it into your chart, right? Transfer not necessarily as an image, but with the appropriate verbal content, right? That's a key thing that is a difference maker because health records contain a whole number of things that fit in a box, right? Like, you have all those things that you checked off on your form when you signed in, but then there's a lot of free text, right? That is also mixed in there with opinions and, people thinking about things and interpretations and images, and it will be able to help organize and exchange a lot of that information that kind of gets lost from system to system. And it takes just some of the onus off of everybody having to move to the same way of identifying certain issues, especially because we are not, especially let's talk social issues, we are not in the habit as clinicians of calling out and structurally coding for and identifying some of the socioeconomic things that may be affecting our patients and their outcomes. But with large language models and the like, they can call out some of those things that are true, right? That we didn't code for, even though codes exist, right? And codify those things in a way that will allow, capturing, restructuring of resources and those kinds of things, because it was just sitting there in the free text.
Yeah. I mean, I even just think about middle name versus middle initial.
Yep.
Not that that's like the most key health information, but if you have two different systems and one's taking middle name and one's taking middle initial, and you want to combine that into one, okay, it's still a one step to take all of those middle names and turn them into a single initial.
Yep.
And then the downside being you lose that data.
Or everything is shifted over one box and everything that you got from that system is now incorrect because it put the thing after your first name as your middle name, even though that's your last name. And now no one has any last name and all the data is wrong. And again, when did you figure that out? After, because all of those things get found out after, right? When you need to look for it or use it after, because that's how life goes.
Yeah. Thinking back to where we've started with consumers and non-medical professionals, non-providers, patients, everyday folks who are engaging with, not just large language models and AI, but the general world and, different doctors and things. What do you feel like are kind of the risks of AI entering the healthcare space? Like, where do you feel like are the potentials for danger right now?
So I think the biggest potential for danger right now is, who do you trust?
Yeah.
Right. There is an abundance of information, of content, whether it is being generated by AI or whether it's being fed to you because the algorithm said so, right? And what's really challenging about that is, again, you don't know what you don't know. That's why I was looking it up in the first place, because I knew I didn't have the answer. And trying to tell the difference between a charismatic, salesperson, right? And a really smart, vetted, educated person in the space is not overtly obvious when people can just assign themselves titles and assign themselves to be experts without any, real evidence. Let's be real. Bill Nye and Neil deGrasse Tyson are not the most exciting people in the world, right? But you know their names and you know who they are because over time they have demonstrated that the things on which they talk about, they are experts in their field. But it wasn't because they are so charismatic. And unfortunately, where we are now with AI and algorithms and sending you information that it would think that you like, you don't necessarily know who you're listening to. You don't know if I'm a board certified physician and that's why I'm Dr. such and such, or I'm a nutritionist and that's why I'm Dr. such and such, or I just call myself doctor because I know that I am well versed and knowledgeable in this space, right?
Yeah.
Like
DOC.
Yes. Yeah. I mean, you just don't know.
Yeah.
Yeah. And then because there are so many things that can be true, but not the only truth. So for example, there's a lot of stuff out now on like superfoods and nutrition and things of that nature. So you can tell me that blueberries are, I'm just making something up at the moment, but blueberries are super duper superfood because they are antioxidants that will help, fight and prevent cancer. They are anti-inflammatory. They give you great energy. They'll help your skin and, pick any number of things, right? What's missing from that is context. Yes, a blueberry can have some of those attributes, but not because they are unique to a blueberry, but because, right, foods that have antioxidants do this, right?
Yeah. Certain
foods are anti-inflammatory. It's not, everybody needs to go out and buy a pound of blueberries.
Yeah.
And that's the part that's missing for a lot of people. And then the other thing too is being able to tell the difference between somebody, and I'm including medical people in the somebody who is benefiting from the sale or wherever it is that they're telling you that you now need, right? That should raise So put an asterisk.
Yeah, because I even think about what we do at House Call, which is we create blogs on topics that we feel are relevant to our customers, to our providers, to our users, to people who might want to visit our site that we think are interesting, but also around topics that we want to be relevant for on Google. So we're not, I also find horses very interesting. There are no blogs on our website. I'm actually pretty knowledgeable.
Right.
There are no blogs on our website. You're also there's 1,000 things that you might be an expert on. Those aren't the blogs we're writing, particularly for House Call.
Yeah.
Now there's no monetization of our platform yet or of our blogs and we're not selling things on our blogs. But that's just to say, we have a kind of positionality in the world, a context that is motivating us to write blogs in the first place. We want to have a website. I wasn't writing blogs before. And so what that, leads me to think is that even unintentionally, we have a skewed perspective when we're writing these blogs. It's partial to home health. Not even in the sense that we're out there pushing home health over other things, but just in the sense that we are looking at the world from a perspective of where is home health going to be beneficial.
Yeah.
And that's, maybe a harmless activity when you're writing non-monetized blogs that aren't being promoted in the world. You're not trying to sell anybody anything. If you take that into a kind of large scale, to its most extreme case, when you're trying to sell a product or a service, and you're creating content and you've got a serious budget behind you to try to push that content into the world, large language models are picking up that content. And so a lot of the informative stuff is coming from a positionality that is incentivized to sell you something.
Yep. And then here's the other thing too. Not only is it incentivized to sell me something, it's incentivized to sell me the something that on the inside, whether I consciously knew it or not, I was thinking I might need a fix for, right? Even if what it showed me isn't a vetted fix, so this is the thing about large language models and the various chat entities, right? Remember, they can be tweaked to show you more of certain type of information or less of certain types of information. It's a part of the reason why you could ask the same question on different models, right? And get different answers, which I don't know that everybody realizes, especially because now when you used to Google something years ago, you would just get a list of resources and then you had to read through them, right? And figure out, is this what I'm talking about? That wasn't what I was looking for. Oh, okay. Maybe this one was, relevant to what I was looking at. Sometimes you had to go 3 or 4 in before you actually found the thing that was actually what you were asking for. Now, even when you didn't necessarily set out to have that type of output, you're already getting some summarized version of the thing that you asked about, and being able to do individual research is getting harder because I don't even know, you didn't even give me any options of what to look at to further read into this topic. So it's very overwhelming and confusing at the same time. For other people, helpful, because some people had no interest in reading 4 or 5 different things to figure out if what it was telling me was correct. This looks good. I like that answer. So let's try it. And that's fine for certain things. That's fine for, how do I get rid of the bags under my eyes, right? But it's not so great if the question is, I'm depressed and I'm having these thoughts and what should I do about it, right? As we've seen recently in the media, AI has not gotten enough training with regard to context, cultural nuance, to be able to sift through and decipher what the meaning of a pause is. Is the meaning of the pause, I'm in crisis? Or is the meaning of the pause, I just lost my Wi-Fi connection, right? Those two things might have very different, outcomes or needs of what needs to happen, action steps behind that. And that's really where we've had some really, scary results. At the same time, you'll have a whole other cohort of individuals who are like, I finally found a safe space to talk. Right. I finally found a safe space to be able, because I didn't want to actually go see anybody in person and tell my, deep, dark secrets, because that's embarrassing. Or
on that topic, so that I've seen that online, like a lot of people utilize, especially young people utilize some of these large language models, some of these tools as a way to bounce ideas, to work through some of the things that are, in their life or bothering them or on their mind. And, that can be a great resource. It's something I use particularly for generating, new ideas. What are other people doing out there? How could you apply other business models, etc.? Do research. A lot of people, though, are very concerned about the data privacy perspective. And what are these companies that then have all this data going to do with it? And we've seen cases where, large companies have lost the trust, for very good reason, of their user base, of their customers and their consumers, because although they said it's all good, it's all protected, don't worry, we don't do anything with it, behind closed doors, the main way they made money was selling your data.
Yes. So let me be clear. There is no HIPAA protection for any of the stuff that you say, that you upload. People are uploading their entire medical records into these things, right? There is zero HIPAA protection on that information, on the medical information that you share. So that's before we're talking about data breaches and accidents. There is no protection if you put your vulnerable private information into the internet, right? For it to go be used wherever. Concerns about data privacy and data safety. I think there's some generational divides in that space, right? There are some of us who are kind of like, everybody's got it anyway, so
where do you think the generational divide is?
I think some of the younger generation, because I'm transparent, I'm an X, right? I'm Gen X, so I think some of the, what is that one? Definitely the Z's, right? And probably, the A's are teenagers, right? They're just now getting to be, the alphas are, young teens. I don't think they have any expectation of privacy. Why would they?
When you're like uploading my entire medical record, I'm like,
yeah, right. And then because in some ways you spent your whole life thinking, well, they have it anyway, so what difference does it make? Because it's on my phone. To get access to so many things, I have to give you information about me, whether I wanted to or not. Just to get food, daggone it, to get a delivery, sometimes I have to give you information about me just to get a sandwich. So there's a cohort of people that have given up on privacy. But at the same time, because it has not been weaponized in any way, it's like, yeah, there's a risk there, but so what, right? And I'm sure if you went across the world and asked other people in different structures how they feel about uploading all of their information into the internet, you'd probably get a variety of responses.
Yeah, I mean, exactly as you said, like it hasn't been weaponized in the same way for Gen Z. So, first of all, there aren't Gen Zs of past a certain age. Like there's just the realities of the aging, and like they're less likely to face certain challenges to health and etc. And then the consequences of like how does the world view those. But certainly as a Gen Z, I'm a bit like, when you bring that up, I'm a bit like, yeah, well, who's going to do what with it? But like what impact would it have on me? So what they know what's going to happen, other than someone has like my address, comes to find me, or steals my identity, let's say. Like those are the things that come to mind. What doesn't come to mind is the ways that I think historically there have been concerns around there's relevant health information that might be utilized against you, for example, to get a job, some of these other things that you might not want folks knowing. And some of those stigmas have gone away. Some of them have gone away and come back. Some of them I just as a Gen Z have not come to experience because I haven't gotten to a stage of my life where it's relevant, just from a perspective of like, I'm not facing the consequences of the decisions about my health that I made when, I was a teenager. I'm just not there yet.
And the other thing too is not just that, but is the perpetuation of biases and stereotypes. Because remember, the machines were trained on data, right? They were trained on data that was generated oftentimes with assumptions behind what happened in the first place. So what the biases are baked in, right? So the space where, Black people feel less pain, right? It's already in the data. So the perpetuation of getting less pain medicine because the algorithm's going to tell me to take Tylenol, right? When it might have told somebody else to go seek medical attention because you need something stronger. It's already baked in, right? It stereotypes about obesity. Again, if a BMI is this, then that therefore means you are unhealthy. Well, that's not necessarily true, right? Like that's not universally true. There are reasons you could have an elevated BMI and not be unhealthy. Let's take muscular people as a primary example. You can have an elevated BMI, right? And still be a very healthy individual. So there are a lot of things that are mixed into the training that are not on the surface, but that will come out in the output. And when you're talking about how could that data be used, you know, in ways
that you don't want it to,
that you don't want it to be used, right?